Welcome to John Redmann, Power of Attorney, the show that aims to empower you through knowledge of the law. I'm Attorney John Redmann.
And hello, everyone. I'm Shauna Sanford. Welcome to the show. Well, if you don't have health insurance for yourself or for your family, you are not alone. A 2012 census report found that Louisiana has one of the highest percentages of people who do not have health insurance in the United States. The Affordable Health Care Act, also known as Obamacare, will likely change that number. But for many people, getting enrolled is proving to be extremely difficult.
Navigating the exchange can be very confusing, especially for those with little to no experience buying health insurance. Our guests today are Brian Burton of Southwest Louisiana Area Health Education Center and Jim Pittman of Louisiana Health Cooperative. They have lots of great practical information to help get you started.
And we look forward to talking with them. But before we bring on our guests, we've been talking about this. Lots of people are talking about this, and there seems to be a lot of confusion about it. So we thought it would be really important to bring some folks on to really sort of get a basic understanding of what's going on.
Absolutely. We want to have a respectful discussion without all the screaming and yelling. Never mind the sky is falling. Never mind that all is well. There's no real glitches. Let's talk to people today. Let's talk to experts today who are not interested in having a screaming match. Let's talk to people to share with our viewers about what is going on and what's going to happen after we get past the glitches. Let's give them the practical information.
Exactly.
I'm looking forward to this discussion.
So am I. And coming up next, Brian Burton and Jim Pittman will join us to talk about the Affordable Care Act. So stay tuned. We'll be right back after this. Hello, everybody. Welcome back to the show. Well, if like many others out there, you've been trying to buy health care insurance through the Affordable Care Act, also known as Obamacare, and you've run into one issue after another, and now you don't know what to do, well, our guests today will have some answers for you.
Brian Burton is with the Southwest Louisiana Area Health Education Center, a nonprofit organization that does great work educating Louisiana citizens about health care and gives people the tools to live healthier lives. Brian, thanks for being with us. And Jim Pittman is Communications Director for Louisiana Health Cooperative, which is one of several insurance options out there under the Affordable Care Act. We're going to have lots of information for you today on the show, plus we'll have other helpful links to help guide you on our website, johnredmannpoa.com/healthcare.
It's great to have both of you here with us today. This is a big topic, lots of confusion out there. So let's start at the beginning. Brian, let's start with you. Okay. When we talk about the Affordable Care Act, what exactly are we talking about here?
What we're really talking about is a system in place that has included 10 essential health benefits to make sure that people that everybody that enters the insurance marketplace and that everybody that has an insurance plan has those 10 essential benefits to them.
Yeah, and I know there's been a lot of talk out there, and still I know that you're coming into contact with people who really just aren't sure. They think that perhaps it's some sort of government insurance plan. That's not what it is.
No, I mean, really the Affordable Health Care Act is a bunch of systems that come together. The insurance plans that we look at, the qualified health insurance plans, are written by the insurance providers in the state of Louisiana. They are approved by the Louisiana's Department of Insurance, and they are basically qualified as a qualified health plan, making sure that they contain all of the 10 essential benefits that were written into the Affordable Health Care Act.
Okay, and you mentioned 10 essential benefits. You've said that a couple of times now.
So it's everything from hospitalization, emergency room visits, maternal care, lab services, mental health services, rehabilitative services, pharmacy services. Those are the things that all healthcare plans must have now, and that's really what the Affordable Health Care Act wrote.
Okay, Jim, tell us about your organization and how it plays into the Affordable Care Act.
Absolutely. The Louisiana Health Cooperative is a nonprofit member-governed health plan, meaning that our board of directors will eventually be governed by at least 51% of our members. We're independent. We came into existence as a result of the Affordable Care Act through loan money from the federal government, meaning we have to pay it back over time through membership and premium that we'll be collecting from our members. But we are also a federally qualified health plan meaning we participate on the federal health insurance marketplace, providing individual and small group health insurance benefits. We will also provide, though, individual and small group health insurance benefits off of the federal health insurance marketplace. So we're also in the process right now of credentialing over 385 independent agents and brokers that will be working with us throughout the state of Louisiana and offering those products as well. So we are provided throughout the state, in every single parish of the state of Louisiana. We provide point of service and HMO type products.
Well, let me jump into the discussion, and just to make sure our viewers understand what each of you do. Your job is to, your company is a sort of a new kid on the block. You're competing with Blue Cross Blue Shield and all the other insurance companies that before Obamacare or the ACA, you're competing to offer health insurance, and you are basically complying with the regulations that the Obamacare or the Federal Health Care Act lays out, correct?
Absolutely.
Okay.
We're providing competition in the Louisiana marketplace statewide, and we have to follow all the regulations that a federally qualified health plan participating on the marketplace has to follow.
Okay, and what you're doing is your job is to try and help Louisiana citizens understand their options under Obamacare or the new Federal Health Care Act, how to get health care coverage, where to get health care coverage, and answer questions for people who think it's good, bad, or indifferent, just to answer their questions. Is that a fair statement?
That is completely fair. I think that what we're really focusing on is the 800,000 people in the state of Louisiana that are underinsured or underinsured that are entering the insurance marketplace for the very first time.
That's huge.
That is
800,000. These are people who haven't had any interaction with insurance, right?
That is correct. And so what we're doing is really educating them on that process. Everything from what is the difference between co-insurance and co-payments, what are deductibles, what are premiums, educating them on that process. What is the insurance process? And then two, educating them on what are the options available in their community.
And you do that as you're not paid. In other words, people who need insurance or who want information about insurance, that it costs them nothing to talk to you and the people in the agency that employs you, correct?
That is correct. Part of the Affordable Health Care Act is there was a pot of money that was set aside specifically to help navigators, to train them and to help them provide that education throughout the country. And that's what we're doing. I mean, we are paid for by the federal government to provide unbiased information. So we show people all of the qualified health plans that are out there. We help them navigate that process, and
hence the term navigators.
Hence the term navigators, to navigate that process and then help them to figure out what is the best for them. We do not pick any particular provider or any particular plan. We just want to make sure that you have all the information so you can make the decisions that are right for you or your family.
You know, it's so interesting because I was talking to someone not very long ago, and he said to me, I just wish they would tell me which plan to choose. It just seems like so much information. I just need somebody to tell me which plan to choose, but that's not what they're there to do. And what I've heard is that really you can get an apple-to-apple comparison of the plans.
And that's the beauty about this, the way that it is set up, is we can really look at all the different qualified health plans, QHPs, across the board, and look at which one is the right for you and your family. For example, there are those that might live in the southwest corner of the state or the northeast corner of the state. You know, Lake Charles area is very close to Houston. Many people from that area like to be able to have options where they can cross Texas borders. Same thing with communities like Tallulah, Louisiana, and the northeast corner. They like to be able to cross over into Jackson. So maybe for them, a plan that gives you the ability to cross state lines is more beneficial than other particular plans. So we just really want to try and understand what the best for you, what are your needs, and let's help you by showing you what plans are out there available to meet those needs.
It costs nothing to get help from you and other navigators navigators that work with your agency? What's the best way for people to talk to you or people that work with you?
Well, I think that the first thing that you could do is you could visit our website at louisianahealthcarenav.com. I think there are many different tools that people will be able to access. One of them would be to request a presentation. We have 13 advisory groups throughout the state that we work together to find those people who have a stake in making sure the constituency they represent, whether it's faith-based organizations, community-based organizations, civic, any organizations that have a gathering of people that would like one of our navigators to come and to really provide a community presentation on basically Affordable Health Care Act 101. And then from there, what we're able to do is we're able to make referrals. One of the things the navigators do is they work with all of the different entities in the state that are able to provide assistance. So it's not just the navigators, but the certified application counselors, the federal qualified health centers, the hospitals. Many of those people also are out there to be able to provide assistance. They just don't have that outreach arm.
Follow-up question. Suppose you're an individual, maybe you live out in the country, you're not associated with a big church or civic group. Can you get help over the phone or via that website that you named? What's the name again?
LAHealthcareNav.com. And the beauty about us is that we are an outreach entity.
Right.
Our goal is to go out into the rural communities and provide that education in rural communities, not to expect people to be able to come to the metropolitan areas.
And we're going to put the links on our website.
That is
just
correct.
So you know, for our show website.
And for those that do not have access to the internet or to the website, we also have numbers available that can be
We'll put that on
there.
our website as well.
That is correct.
We mentioned hundreds of thousands of people out there who do not have health insurance. They're watching today, so let's talk to them and help give them some real practical information. Jim, we were talking earlier, and you said that these are the people who you are looking to hear from and to work with. So, getting started, where do you begin? We hear so much about the glitches. There are glitches there, although we've been told that those glitches will be fixed by the end of this month. So, how do you get started with this, even with all of those glitches that are going on?
That's a good question, and we know with 800,000 people who have gone without health insurance, there's a large percentage of them that require a lot of education and background on just what health insurance is all about. And with that, we're working in partnership with the navigators, with independent brokers. We're doing everything we can through social media, through our website, we have an 1-800 phone number that people can call and just ask questions and hopefully get questions answered. And we're trying to do everything we can just to provide the basics about what health insurance is all about and why it's important, and then provide them information if they're interested in our products that we have to offer.
Yeah, and I know that you have some scenarios that you're going to share with us.
I do.
Yeah, could you give us one, because right before we go to break, because we want to give people just an idea of what it might cost them.
Okay.
This is relative to your insurance company, correct?
The scenarios that I'm going to give is, Kaiser Health does a wonderful job of providing a subsidy calculator or a cost estimator on their website. We also include it on our website as well, so that anybody interested in getting a ballpark of what their monthly premiums might be with subsidies and tax credits that might be that they might be eligible for, they can go to that calculator and get a feel. And you guys probably provide the same calculator on your site as well. It's a wonderful tool. And this morning before I came on the show, I just ran a few scenarios just so that we could have an idea of what potentially a premium might be. And here's the first one, and this is for an individual living in Louisiana with a zip code similar to this area, because there are a few variables that you need to enter in the system, with an annual income of about $25,000, age 26, non-smoker, and no children, living on their own. Their amount that their health insurance premium for the year would be about $2,800. However,
Or female, I didn't hear.
that would be, it doesn't matter. Age,
or female, doesn't matter.
Male,
Just
female,
gender.
doesn't matter
Okay.
anymore.
Okay.
That's part of the new health care
big.
law.
Right. Okay.
Doesn't matter.
But for example, their health insurance premium for the year would be about $2,800. However, this person would be eligible for subsidy or tax credit that would reduce that by $1,105 a year. So now they're looking at an annual amount of $1,729, and their monthly premium would be $144 per month. And this is for a silver level plan.
Oh, now I'm glad that you mentioned that, because when it comes to the different levels, it's all based on metals. It's all based on, we have to take a break. I'm going to let you all talk more about that when we come back, but we do have to take a quick break. Coming up next, we're going to include your questions about the Affordable Care Act, so stay tuned. We'll be right back. Hello, everybody, and welcome back to the show. We are talking today about the Affordable Care Act. We are going to take your questions, and we know that you have lots of questions out there. But first, we went into that break talking about the different levels of plans that are available, all based on metals. Okay, so kind of give us a briefly, what are we talking about there?
Well, I think that there are 4 different levels. There's the bronze, silver, gold, and platinum. The more precious the metal, the better the insurance policy.
Okay.
60, 70, 80, and 90. So a bronze plan, you're going to pay the insurance provider is going to pay 60% of the cost, and you're going to pay 40% out of pocket. 60, 70, 80, 90. So a platinum plan, the insurance provider is going to pay 90%, and you're going to pay 10% out of pocket.
Okay, and so with the scenario that you just gave us, Jim, you gave us a 26-year-old, no kids, non-smoker, would end up paying $144 under one plan, but that drops under another.
Yeah, if that person were to select, say, the bronze plan, which is, you know, as you go to the bronze level, there's fewer bells and whistles and more sort of potentially out-of-pocket costs. But that monthly premium for a healthy individual aged 26 would be $74.33 per month.
Okay.
After subsidy.
And to be clear, no matter what plan you choose, all of them contain those 10 essential benefits.
That is correct.
10 essential benefits, no matter what plan. And we were just talking about the...
There's a related topic, and it's a big subject of discussion, and we talked about it a little bit before we came before the cameras, and that is there's this debate about, well, what about people who refuse to get any health insurance coverage? And there's a debate that some people have about requiring insurance companies to cover those who have pre-existing conditions. Some of them are very serious, like cancer, that it's going to be very expensive. And I wanted to get your takes on this. The issue about, well, if you make insurance companies, many of them, well, they're private insurance companies, if they have to cover pre-existing conditions, that makes the cost of insurance for everybody go up, except the other side of the token is if insurance companies don't cover these people who have pre-existing conditions, well, who's going to pay for the uncovered insured? It's going to be the taxpayers, isn't it? Right. So is it sort of, is it more expensive to treat people without insurance because they only show up in the emergency rooms, or is it less expensive to have them have good health care coverage? Well, you're in the health insurance business.
Absolutely.
So
I've been in the
question?
healthcare and health insurance business for over 25 years in Louisiana. And I can tell you, you know, the cases where people go without health insurance, okay, and they wait until the last minute or until something becomes life-threatening, and then they go to the emergency room and then potentially end up on the operating table, that's when it becomes extremely expensive for these healthcare institutions to take care of them, and eventually taxpayers or whoever's paying for the cost of this uninsured person to go to the emergency room and then get whatever treatment they need at, you know, sort of within a situation to where it's almost too late. Now, if you take the other scenario and you look at what could potentially happen with somebody with insurance, is good insurance plans like ours and the others that participate on the federal health insurance marketplace, they're going to encourage people to have annual checkups. They're going to encourage people to take their medications, to control their hypertension, to control their diabetes, to control these disease states that could potentially become extremely life-threatening and costly, for society as a whole. And what we've seen over the years is healthcare cost rising at a tremendous level over the past several years, especially. So the theory behind the Affordable Care Act and these types of insurance plans and the marketplace is that if we can get people involved with insurance plans, we can get them the early detection that they need, we can get them the medication that they need to control their disease, we can in fact keep costs down over a period of time.
Yeah.
You know, as I've been, for the last 2 months, as I've been crisscrossing the state, working with our navigators and meeting with people all across the state, one of the things that is the biggest aha moment for people is just the realization that in Louisiana, we no longer have a charity healthcare system. Everything's been privatized now. And so I think that people need to understand that there are lots of exemptions from the Affordable Health Care Act, but that doesn't necessarily mean that you're going to be exempt from the cost that it's going to cost you should something happen to you. So we really need to work at that. Part of the Affordable Health Care Act is that there are now individual mandates. And those individual mandates in the year 2014 for one person is going to be $95 per person, up to 3 people in the family, or 1% of your income, whichever is higher, not lower. So, and then of course it's going to jump to $325 per person in year 2, which is year 2015, and then it's going to go to $695 for people in year 3, or 2016. So it's going to get higher and higher.
I mean, you're talking about the penalty, right?
I'm talking about the penalty, which is called the individual mandate.
This is the penalty.
And right. And so one of the things our navigators are able to do is to sit there and help them understand that instead of giving this money to the IRS, let's take that and let's put that and have something for it. You know, in the example that Jim gave, one of the things we didn't talk about for a 26-year-old is the fact that there are catastrophic plans out there that are even beyond the gold, silver, platinum, the bronze, silver, gold, and platinum. And so these are plans that are just very basic, bare bone plans that in case something traumatic happens to you, you're covered.
Yeah.
It does have some preventative measures, a car accident in there, you know, you fall off the roof, putting your Christmas tree lights up, and break your leg or things like that. Yeah. And what we don't want is for people to get caught into a circle that they'll never be able to get out of with healthcare bills.
And we want to get to our questions because we have lots of them, but since you mentioned penalty very, very quickly, even when you pay that penalty, we want to be clear, you're still not getting insurance.
That is correct.
Okay, so you're just paying the penalty. That doesn't mean that you're getting the insurance if you do pay the penalty.
And that's why it's so important that our navigators work with people to explain that to them, because instead of giving that money up, maybe we could put it towards something and at least have something.
Okay, we've got a question from Eddie. He says, is dental insurance included in the required coverage? Also, what about mental health coverage?
Yes and no. Mental health, yes. Mental health coverage is one of the 10 essential benefits, so that will be covered in there. Dental is not. Now, pediatric dental is, but I think that there are some plans that do have dental coverage in there, but it is not one of those 10 essential benefits.
Okay. We've got a question here from Dorothy. Now, her question is really in line with what we're hearing about today. She says, I heard lots of people were receiving notices that they were getting dropped from their insurance plans. I thought the President Obama said we could keep all of our health insurance. Can you explain exactly what's happening with that?
Briefly, because we're running short.
Right.
Short
well,
answers at this point.
I think that as the insurance companies begin to, and you could probably answer this a little bit better than I can, but as the insurance companies begin to work with the previous policies they have, and that the fact that those policies do not have those 10 essential benefits, there is going to be a cost in there. But at the same time, what we could do is we could show people what their other options are, and let's look and see. And there might be something for you even better than that. But my understanding is it's just about 5% of all people that are covered are really falling into that circle of people.
Jim, you want to add something?
As I understand it, employers have to offer a health plan that meets certain minimum requirements. And if these plans do not meet those minimum requirements, and one of them is, and I can't remember the percentage, the monthly premium can't go above a certain percentage of somebody's income. And so as a result, these employers are looking at this, and what they're seeing is, okay, this person can get a better plan through the marketplace than what we can afford to give them, and that's usually the scenario.
I just want to add very briefly, there was a very interesting editorial in the Louisiana Advocate in New Orleans. From Harrop wrote it, quoting Consumer Reports, saying that some people have health insurance plans that are really awful. They're substandard, and they don't come close to meeting the government's requirement, which is a watchdog saying you got to have halfway good insurance. And many people are being dropped. They think their health insurance is good, but they have not had a medical crisis. And they have a medical crisis, and the health insurance says, we're not paying for that. Well, they never had an opportunity to see how bad their health insurance is.
And those are those 5% that I was talking about.
Okay. We have another question here very quickly. 90 seconds I'm being told that we have. I appreciate the fact that we will now be accepted with pre-existing conditions, but I've heard that some conditions are not covered. This particular person says that he has cancer. Is that true?
My understanding is that all conditions will be covered.
That is correct. The beauty about the Affordable Health Care Act is there's no more underwriting. Okay.
Okay. And maybe we can get one more in from Cheryl. I like the idea of everyone having health insurance, but how am I supposed to pay monthly premiums even with a subsidy? Will everyone qualify for those subsidies?
Anyone that falls with between 139 and 400% of the federal poverty level, and if you go to healthcare.gov, it'll define that for you. But there will be many people who will be with subsidies will end up paying sometimes zero monthly premium for a health plan. So it's worth checking out.
Yeah.
And it's important to know that there are cost sharing reductions that are also available for people, and so that helps them with the out-of-pocket expense and the co-pays and the deductible amounts that you have to have also. So,
yeah. Well, I know a lot of people are hearing a lot of things, and they may not be hearing the correct information. So we really want to encourage them to go to the website, go to the links that are listed there on the website, and really dig and search on your own to get good information. Thank you all so very, very much. We appreciate it.
Thank you for having us.
Excellent information.
Yeah. And thank you all so much for joining us. Be sure to tune in next week when we will focus on what small businesses need to know about the Affordable Care Act.
So start sending in your questions via Facebook, Twitter, and email. The website is johnredmannpoa.com. You can also see past episodes of the show. So thanks for watching, and we'll see you next time on John Redmann, Power of Attorney. Really.